The sense of alarm over drug abuse in Massachusetts has reached a new level. State figures show that last year, for the first time, more than 1,000 people died from opioids. These include heroin and prescription pain medications. But the problem can also be measured by a shortage of access to drug treatment. Providing that measure recently was a report from the Center for Health Information and Analysis. We'd like to welcome the center's executive director, Aron Boros. Thank you very much for being with us, Aron.
Hi, thanks for having me.
First of all, start by what is drug treatment, at least if it's done right?
So if you look at substance use disorder, which is the medical term for what we looked at, you're looking at anybody who has a problem with addiction to the opioids that you mentioned, or to alcohol, or to other substances. And we think that about 1 in 10 people in Massachusetts has an addiction like that that either causes medical problems or causes an inability to live their everyday life. Of those 1 in 10 people, only some of them are seeking treatment for a variety of reasons. And when they seek treatment, what we're trying to do in this report is really look at what treatment is available and how hard is it to access for different patients.
Let's talk about the different stages of treatment maybe. One of them is there's a crisis, so you have to go to the hospital.
One of the things we looked at is even just getting into the system is hard. So you might go to an emergency room. You might go to your primary care physician. You might try to access some of the specialized treatment facilities directly. And there's no one right way. And that in and of itself is complicated because you can't implement best practices just in one place. You have to be educating emergency rooms about how to treat these conditions, primary care physicians, even the court system and the criminal justice system.
Well, the other thing here is you have to have a continuum of care. This isn't about just one stage and one time.
Right, so we looked at everything from acute inpatient detox all the way through long-term residential non-clinical care, where you're in a group home setting or something like that, which is supporting your recovery, but where you're not receiving clinical services. And in between those two ends of the continuum, there's probably 7 or 8 different kinds of levels of care that you might access, which we tried to take a systematic look at to describe whether they're available and where the barriers to access are.
If you put that on a diagram, where do you see the biggest choke point or bottleneck?
It's everywhere. It's really frustrating. In general in Massachusetts, if you need to get detoxed, if you need acute inpatient detox because you are currently having an acute episode of substance use problem, you can generally get access to that. But after you get detoxed, the step-down care, the additional opportunities for recovery, all of them have challenges. And those challenges are lack of capacity, where the facilities are full, lack of understanding about which facility is best, complications in outpatient medication-assisted treatment. So there are some situations where you don't need to be in a facility or have 24-hour care. But getting the medications that are helpful to treat these there are a lot of barriers to that. And then again, payment, sort of which of those different kinds of care is there effective payment for, and where there's a smooth relationship between the patient, the provider, and the insurer.
What about capacity? Is this about people who say, I don't want that recovery house around the block for me, or is it maybe the staff?
Yes, it's all of those things. So there is a lot of recovery and treatment that happens in typical medical settings. So you wouldn't know that this is a setting for substance use disorder treatment. However, there are settings that are specialized. In particular, there are places called opioid treatment centers, or OTPs. And these are standalone facilities that treat opioid addiction through a variety of medications and therapies. And there can be stigma around those facilities and where they're located, which presents its own barrier to access. But there's questions about reimbursement rates. There's simple questions about just having enough of these facilities in any particular geographic region.
How are we for insurance coverage? And I imagine there might be a requirement for some kind of coverage, but maybe the menu of options isn't necessarily that great?
We typically find that the menu is pretty good. So typically, insurance companies cover the full continuum of medical care. Now, there's after you kind of go through that process of medical care, there's residential non-medical care that's generally not covered by medical insurance, but that's probably appropriate. And you can get access to that care through some other state programs. However, so you have a good menu, but even within that menu, there might be restrictions or limitations on cost sharing that can be a barrier. One of the medication-assisted treatments is an everyday kind of thing. Imagine paying a copay for a drug every day. No matter what the level of that copay, that's going to be a burden on any family. There's a review of different prescriptions and review of different treatment approaches at the insurance company level. And again, that review is generally evidence-based and systematic, but it's complicated, and it's another party who's kind of getting involved in the treatment decisions. So you have the doctor, the patient, and the insurance company, which naturally introduces miscommunication and frustration.
What about quality control? I know it wasn't that many years ago the Boston Globe had a series on sober houses, and some of the things described there were pretty alarming. Can you really monitor that effectively?
Yes and no. So there's a lot of oversight of these facilities, licensing through the Department of Public Health and other oversight by the insurance companies themselves, and that exists. On the other hand, and my agency is actually responsible for quality measurement throughout the Commonwealth and all medical care, it's a developing science, and certainly this particular area of substance use disorder, the quality metrics are still in development, and so I don't think we have a good systematic look at quality, even though there's good regulatory oversight.
Well, I know this study was not done to sit on a shelf, and I guess it's already getting some attention because I know Governor Baker wants to make some changes, so I guess what's going to happen after this?
Absolutely. There's two immediate things that will happen. The governor has a task force that's looking at this, and then there's another state agency called the Health Policy Commission that's explicitly required to take this report and then act on it and make recommendations for future work.
Right. Thank you very much for being with us.
Thanks for having me.
Aron Boros from the Center for Health Information and Analysis. In a moment, an opera discovery for Boston and a classic from Eastern Europe. But first, this message.